Good morning. Welcome to another episode of Dermis with Dr. Vignesh Narayan. Today we'll be talking about hyperhidrosis or excessive sweating. What is hyperhidrosis? Well, to understand this, you must understand why we sweat. Sweating is a mechanism by which your body controls excessive heat by evaporation. And when this sweating occurs in an amount that is excessive of that required for the regulation of temperature, it is called as hyperhidrosis. Now, this may be specified by the activity and the gender of the person and also the climate that the person is in. Hyperhidrosis is broadly divided into two types, primary and secondary. Primary one usually has no identifiable cause or a neurological cause, whereas the secondary type of hyperhidrosis tends to have other endocrine disorders such as hypothyroidism and also hyperadrenalism. Now, this hyperhidrosis tends to present as increased sweatiness, and the primary type typically affects your palms, soles, face, and your flexures such as your armpits. Now, this may cause significant distress, include difficulty in writing and also the staining of your clothes. Sometimes this hyperhidrosis may be complicated by bromhidriosis, in which there's an overgrowth of malodorous producing bacteria. It is to be noted that primary hyperhidrosis typically improves when the person is asleep and it occurs when the person is awake. Typically, it occurs after the first social contact in the day and emotions make it worse. Other triggers for hyperhidrosis include spicy foods. Now, if you do have hyperhidrosis, you must visit your dermatologist, and they may sometimes do special tests like a starch iodine test to know which area is sweating the most. In addition, there are a number of treatment options available for this hyperhidrosis. They range from creams such as aluminum chloride hexahydrate that go and block these overactive sweat glands, and these have to typically be applied at night when the sweating is least. And also there are oral agents that work against this cholinergic axis. But it must be kept in mind that these agents may have side effects that include dryness of your other secretions as well, and you may have difficulty in passing urine. And your dermatologist will typically balance these side effects and the desired effect. Another treatment modality includes the use of botulinum toxin to affect the overactive sweat glands and to reduce the sweat production. Also, there are a number of energy devices that are able to affect the same. And last but not least, there are surgical options for hyperhidrosis that typically go and affect the ganglion that produces the sweat. But it must be kept in mind that blocking sweating in one region using this method may result in excessive sweating in another as a compensatory mechanism. Remember, if you do have hyperhidrosis, to stay calm and visit your dermatologist. We can win this fight together. And if you like these videos, hit the subscribe button. I'll catch you next time.